Just at the point when St. Lucians are demonstrating confidence in the AstraZeneca vaccine comes word of a growing list of countries, mainly in Europe, placing a temporary pause on its administration. Their concern is the suspected increased risk of blood clots and their serious health implications. The president of the St. Lucia Medical and Dental Association, Dr. Merle Clark, says it's important to note that the suspension is to allow for the concerns to be looked into seriously.
These are temporary measures while investigations are done.
The St. Lucia Medical and Dental Association's president is cautioning against a rush to judgment. She notes that millions of people worldwide have taken the AstraZeneca vaccine with very few complaints.
With COVID-19, a significant rise in those events had been noted. So be it what we call DVTs or deep vein thrombosis, or PEs, pulmonary embolism, or heart attacks and strokes, all of which in a broad sense are related to clots of sorts. We are seeing a rise in those cases generally in St. Lucia, in both the north and the south of the island, and certainly globally, a rise was being seen with COVID-19. What needs to be determined always, and that's why investigations are done, is were those patients going to get clots anyway, as it pertains to the vaccine, of course. You have to look at who the patient is. So there are patients who have what we call a hypercoagulable states. So they are at risk for having clots anyway. So you're looking at some autoimmune diseases, in some cases such as lupus, where those patients do have a tendency to form clots. So there are patients who are more at risk. Even the use in certain patients of oral contraceptives may slightly increase the risk of clots. So you have to know who are the patients that we are looking at, who are the patients who got the clots. Is it at all directly related to that? Would they have gotten the clots anyway?
Dr. Clark says it's incumbent upon science to examine all credible concerns. This, she says, should inspire confidence in the process.
Few numbers have been seen in terms of a rise in thrombotic events or clots, and we do not yet have details of clots in what part of the body as such. But that is science for you, and that is the way medicine works. If something is observed, it needs to be investigated, and that generally is simply the wise thing to do.
As of March 10th, 2021, over 5 million people, mainly in Europe, had taken the Oxford AstraZeneca vaccine, with 30 of the 5 million reporting blood clotting related incidents. This has led to the European medicines agencies to conclude that the figures are, quote, no higher than that seen in the general population, unquote, and says there's no indication that the vaccine caused the condition. Stanley Lucien for the HTS News Force.